everybody. I'm presenting this evening my presentation on sane nursing. It's something that is super important to me, something that I've always strived to become during my 18-year nursing journey. Just haven't gotten there quite yet, hopefully soon. Sane nursing stands for a certified, sexual. Okay, so Sane Nursing is a sexual assault nurse examiner. It's a special branch of nursing. The definition: a sexual assault nurse examiner is a qualified forensic nurse who has received special training to conduct sexual assault exams. These exams often happen after sexual abuse, domestic violence. They can also occur in elderly abuse. They actually are a pretty encompassing thing that goes into a lot of different aspects of emergency and abuse care. Qualifications: a registered nurse license for the state that the nurse is practicing in, so they must be an RN and be currently licensed in the area that they are choosing to practice in. Some states have a compact agreement where you can be licensed in multiple states. Other states do not have that agreement, and so you need to be very careful to make sure you are registered in the state you're practicing in. It is very important for the nurse to have advanced skills in practice that require advanced physical assessment skills. This is really important to be able to do a head-to-toe assessment fairly quickly when a patient first comes in, to be able to focus on things like their airway, whether or not they're breathing okay, things that are emergent, and things that could need to come before the actual sexual assault evaluation. Although that is really important, and gathering evidence is extremely important to be able to preserve it. You want to make sure that the patient is safe while doing so. So that requires a pretty fine-tuned set of skills as far as evaluation of head to toe pretty quickly. The sexual assault examiner course is about 40 hours of classroom training that is specialized for the forensic nurse or the sexual assault examiner. And a lot of this is offered through the forensicnurses.org or there's different organizations. And also requires at least 40 hours of in-clinical training time of a new training RN following a registered nurse, or sometimes a nurse practitioner that's already doing the same protocol. The primary function of a SANE nurse is to collect and to examine evidence in sexual assault cases. Again, they also are involved in domestic violence and child abuse, and sexual assault cases can kind of be an all-encompassing term. The SANE nurse can bring a nursing perspective to an investigation, such as when there is even death. There are SANE nurses and forensic nurses that work in the morgue and help determine different stuff from the nurse's point of view, to be able to give a unique perspective and really find out what happened. It's really important that a SANE nurse be able to perform trauma-informed care, which is a special type of nursing where you're able to take a vulnerable individual or group. You're able to minimize the harm that can be caused by an invasive exam that may cause a patient to be triggered. You're taking a patient that has already been sexually assaulted and abused, and often you're having to do vaginal exams or rectal exams. You're having to really get very personal with the patient, get into details. You're having to take a lot of pictures and gather a lot of evidence, and it can really make the patient feel like they're re-violated if the registered nurse is not aware and able to perform trauma-informed care. That's a whole nother special type of care that is very psychologically specialized. Function of a SANE nurse: a registered nurse that is competent and able to perform a sexual assault evaluation, collecting and categorizing important evidence. This is extremely important. If the SANE nurse does not appropriately categorize the evidence or collect it or photograph it and or store it, it could be inadmissible in court, and the victim could end up not ever getting justice. There's an important ability to interact with the victims and obtain the evidence with minimal harm to the patient, psychologically or physically. Again, that goes into the trauma-informed care. It's really important that a SANE nurse not only be educated on what she's doing and how to collect the evidence, but be able to psychologically and emotionally take care of the patient who's already been victimized enough. Ability to present evidence in a court and be able to explain evidence gathering and evidence conclusions. It's really important that the SANE nurse be able to present the evidence in court, be able to explain the procedures that they followed, what happened, the events that took place upon the victim arriving at the emergency room, and be able to back up the findings that they have. That's extremely important in order for the victim to be able to get justice. The salary, the average certified or the average SANE nurse salary, the beginning salary nationwide is about $55 an hour. It's a little bit less in Colorado Springs. A lot of nursing salaries are a little bit less in Colorado Springs. That's pretty common. And experienced nurses can make about $100,000 a year, and that is not the nurse practitioner nurses. Sometimes they can make more. This is just the registered nurse, experienced nurse salary. So a lot of these nurses have been doing it for many years. They have a lot of experience, and a lot of them are probably also responsible for the training of new SANE nurses. These are some of my references. So as you can see by the presentation, it takes a very specialized set of skills to be a sexual assault nurse examiner. It not only requires very fine-tuned, very specialized registered nurse skills, but it also requires fine-tuned psychological evaluation skills, empathy, as well as forensic nursing skills. Sadly, in this world today, where some statistics show 1 in 3 women are sexually abused or assaulted, and that statistic doesn't even cover young boys and men who were also sexually assaulted and abused. It's also a growing need in prison communities, and where there's a lot of sexual abuse and assault there as well. It's a growing field which is very hard and trying on the individual doing it. It's not easy to become, but I feel like making a difference in somebody's life and being able to provide justice for the victim is an extremely important thing. Thank you for your time, and I hope you guys have a wonderful night.